Early in 2008, I was in Bangkok and I was suffering from a persistent cough. And I went to have it checked out at one of the major local hospitals. And they did a very thorough job. They did x-rays and they did scans. And they came to the conclusion that I had an abscess on my left lung. And they advised me, as I was returning to London anyway, to go to the top London hospital that deals with breathing problems. And that was, I had an appointment with John Collins, who is the consultant physician at the Brompton Hospital. He confirmed that I had an abscess and he recommended that I should start a treatment of antibiotics, which would take roughly 1 month. I thought that it would be interesting to see if there was an alternative to this. And I went to see a good friend of mine whose name is Tamara Voronina, and she had been training under one of the leading professors in Moscow. And she said, yes, I think I can cure you. She said, I'm going to give you a combination of treatment with a breathing machine, and I'm also going to give you some acupuncture. I followed this program for about a month, and then I went back to the Brompton Hospital. I saw John Collins again. He looked at my latest x-rays and he said, I've only seen this once before in my career. He said the x-rays showed that the abscess had completely cleared up.
Would you please tell me what is your diet was and what is special program diet?
Well, there was a special diet. I was first of all trying to follow a fairly low calorie diet. I was also using specialized grains. I was avoiding bread, and I was eating vegetables, drinking plenty of water, and eating very little in the way of proteins.
And you usually not eat morning?
No, in fact, I was advised to eat as late as in the day as possible, and when I started, I could only manage to start eating at about 12 o'clock, noon, and then gradually I would extend the time until eventually I got to the point where I didn't eat until about 3 o'clock in the afternoon.
And you have 2 or 3 meals after 3 o'clock, is it right?
No, I didn't. I had probably one more meal after 3 o'clock, sometime in the evening.
It is mean you have 2 meals a day?
Yes.
It is you have fasting about 18-20 hours every day.
Yes, that's right.
Yes, and but the doctor did doctor recommend you to do operation with?
No. The doctor wasn't sure about that. He thought that it might be necessary, but he wanted to see what the result would be after a month's treatment with antibiotics.
All right. And can you tell your name, please?
Yes, I'm David Morgan, and I live in London in number 2 Orme Square in Bayswater.